on one shift, I delivered a baby in one room and then pronounced someone dead in the next room. And it was like a mystical feeling where it felt like the soul of one person actually went into the body of another. And it was like, I'm not a spiritual or religious person, but it was very moving to just feel like, we're bringing life into the world and we're also helping people exit the world at the same time.
Almost dying taught me how to live. Being struck by a car left me in a 3.5-week coma with 15 broken bones and 16 surgeries to complete, including brain surgery. However, I woke up from that coma in an even greater place than I ever foresaw for myself. How? The universe will guide you out of the darkness and into the light if you allow it. Often, spirituality comes off as too highbrow. I'm not about that. Welcome to the podcast that talks and teaches about it through the lens of humor. Together, we'll harness positive energy and use it to work with the universe, all while giggling the entire time. Welcome to Gabriella Rebranded. Win most, lose some. You're the guest that I'm definitely the most proud
awesome.
Introduce and also the most honored to introduce. Yeah. This is Dr. Carl Berdahl. Dr. Berdahl is an emergency medicine doctor at Cedars Sinai. So he was my ER doctor. So when I got he was the one that I was brought into, and that you fixed me basically, and everything that I've been able to do, every doctor that has helped, a lot of doctors has helped. Obviously, none of them would have been able to do it without you. You were the first link in a very, 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 very long chain of links. And sorry, I'm getting nervous. In addition to being an emergency medicine doctor, Dr. Berdahl is also an assistant professor at UCLA Geffen School of Medicine and Cedars Sinai, where he also does a ton of research on diagnostic excellence, AI, vulnerable population, quality measurement, and clinical informatics. With a master's in health policy and management from UCLA's Fielding School of Public Policy. I was just talking to him about how his resume is literally nonstop. We're not done yet. He then takes all that research that he is using and creating as a professor, and you're using it for the future of medicine. And so your current medical school skills are for the current face of medicine, and then all the research that you're doing is for the future of medicine.
Love that. That's an amazing introduction. You're so kind.
No, it's just absolutely wild. But you're looking at one of your finest pieces of work. And by that, I mean, so when I was hit by the car, I was on, and I didn't know what this means. This had to be explained to me by my neuropsychologist last March. So don't feel stupid if you don't know what this means. There's this thing called the Glasgow coma scale. And if you're a 1 or 2 on the scale, you're dead. The scale's out of 15, right? Yes, 15. Mm-hmm. I was at a 3. So I was the lowest you could be without being dead. And you got me to an 11 in 20 minutes.
Well, I'd love to take all the credit for that. You did a lot of that yourself.
I mean, I just lied there.
But, I think you were going through a process of waking up. And, of course, I was there to help support you. But it's just such a special treat to be here. I've had very few opportunities to meet my patients. And so when you reached out to me to ask about this, I was just so delighted because it's so special to be here. Yeah,
which is so it makes a lot of sense to me. But it is insane to me because one of my earliest memory, and it's not clear, it's very, very muddled because my brain wasn't making the best memories for a while, was I'm lucky that my dad is a doctor. I have a medical professional in the family, and my brother's now a doctor. But at the time, he was still in med school. So I have a doctor, my dad's a doctor, and I remember early, when in one of the first or second week that I was home at my childhood home in New York, I was sitting on my bed. I don't know what I was doing because I wasn't allowed to look at screens yet, and I wasn't allowed to read yet. So there's no TV to be watched or books to be read. So I was just sitting, and my dad came into the room almost seeming angry, but he wasn't angry. He was just passionately excited because my over 600-page medical report, he is able to actually understand. So he looked through the ER report and he was like, your ER doctor saved your life. My dad is her biggest fan. He literally, he came out to LA for my podcast launch, which Dr. Berdahl was at, and he came for you. Like, I was an afterthought. He was like, I see her and I already listen to her talk all the time. He was like, I want to get his autograph. But your name, it was just such like a celebrity name in my house. So that's not common, and that you don't meet patients that you treat. I mean, it makes sense because once you leave the ER, you leave the ER, and it's only if you have a doctor in your family that knows to go back and look at the ER report. But that must be so weird for you, treating all these people and you have no idea what happens to them.
Yeah, I mean, it's the situation that I trained for.
Yeah.
And I should start by saying that emergency medicine is a team sport, right?
Okay.
So you can think of me as the conductor who's, helping the team figure out what to do and making sure that it all happens the right way. But there are paramedics involved, right? Like, you came by ambulance, so the paramedics brought you. Then we've got a team of nurses, and then we've got specialists. In your case, we had our trauma surgeons at the bedside as well. So there's a whole team doing everything to make sure that we support you in the best way possible. And it's that team effort that brought you from what we call a Glasgow Coma scale of 111, or the lowest score possible, back up to an area where, you were becoming responsive. Yeah. So it was definitely a team-based effort.
A team-based effort. I mean, that's the most humble thing I've ever heard. But what that's still, you have to be like the conductor. And that's like, being a good delegator is like a skill in it of itself. Like, being a good delegator, that's so something to be had. And when situations, not just like mine, but I'm sure too many people that you've had to treat, it's the most pressure. Like, it's like it has to feel like the most pressure with some of the humans and the bodies, the way that they come in. How do you get your brain to a space where, amidst all that pressure, you can think clearly and are like, this is what needs to go? Because I know with mine, it's like, there was a ton wrong with me and everything had to happen in the right order, which can literally be the difference between if you live or if you die. And you did that. Like, how?
Well, we undergo many years of training to be able to do it. But it really comes down to relying on the basics, right? So you may have heard an expression, the ABCs of resuscitation. At least a lot of doctors have heard this expression, where
I've not.
A is airway.
Okay.
B is breathing.
Okay.
And C is circulation. And so those are really, when it comes down to it, those three things are the most important things to make sure that you're helping someone who's critically ill. So when we get nervous, I do feel my heart rate going when I hear that there's a sick patient, especially a sick young patient coming in. My heart rate starts going and I say, I got to go back to my ABCs. As silly as it sounds, I'm like, okay, A, B, C, and that's all you got to do. Of course, then there's more that comes after that, but that's really what it comes down to, is making sure you stick to the basics.
I don't think that sounds silly at all. I think that sounds really grounding. And I think we need a grounding anchor a lot of times. And
totally.
So often, for lack of it, you're not dumbing it down by saying it's ABCs, but in a way that feels like to your brain, hey, everyone knows their ABCs.
Exactly.
A kid can do this. And then it doesn't feel like it's as big of a deal, even though you are literally dealing with the things that are, I mean, my experience, that's the biggest deal of anything that's ever happened to me. So but dumbing it down to the ABCs. Anyway, I'm just sorry. I'm thinking aloud, processing, because I'm just still so crazy to me.
Yeah. It is crazy. It really is crazy what we do on a daily basis. But as I mentioned, it's a team effort. And, if for whatever reason I get distracted and forget about my ABCs, there's a nurse there. There's, a specialist there, like a trauma specialist, who's going to say, hey, get back to the basics, ABC.
Yeah.
Yeah.
Is that that made me think, because you're also a professor, is that kind of the whole, it's a team thing, working with multiple people? Is that what made being a professor enticing to you? Because you kind of are doing that.
Yeah. Yeah.
Okay, yeah.
I mean, I think there's a lot to be enticing about being a professor.
Yes, of course.
For me, it actually came from my father was trained as a scientist.
Oh, really? Okay.
Yeah, so my dad was a physicist, and so he really liked structure and also, advancing science and sort of making sure that we do things in the right order to come to appropriate conclusions.
Okay,
Yeah.
so that's where it came from.
Yeah,
All right.
I think so.
Yes, but you also get to do a ton of research.
Yeah.
Which I know is very important to you as
Yes.
well.
Yeah, definitely.
Being a professor. But just real quick, do you want to explain a little bit about like what you are researching the most?
Yeah, so I'm a total nerd.
Okay.
But so the thing that drives my interest is diagnosis.
Okay.
So making sure that we come to the right diagnosis, also known as an explanation for a patient's symptoms. And it's very much a nerdy thing for doctors to think this way. Lay people who are patients may not even use the word diagnosis much, but to me, for every case, I'm trying to get to the bottom of it. What is the thing that is driving this patient's illness and driving their symptoms? And so most of my work relates to doing better, finding ways to do better with patients to work together to get to the right diagnosis.
I think that's one that's really important because diagnosis is often the most tricky part. So often it's like they just can't figure out what's wrong with you. And it's like it's getting the diagnosis that is the most painful part for a lot of patients. But I think that's also really beautiful because with that, and I said this to you when I emailed you, what that translates to me as hope. Like you care a lot about the future. And that's you're hopeful about the future.
Yeah.
And with our current world, there's a lot to not be hopeful about in the future. So just speak to that a little, give the people some hope about the future.
Yeah, well, so to start a little bit in talking about diagnosis and the future, so I think that patients often, if they have symptoms that are uncontrolled and they don't have an explanation, it's very unsettling, right? So just coming up with a named diagnosis for the symptoms can be reassuring because then you can go online, you can Google your symptoms, find resources, you can these days use ChatGPT to find out, with this diagnosis, what should I expect? What are the treatment options? So I think it is reassuring for patients in many ways to have a diagnosis that explains their symptoms so that they can understand better, what's going on and how to manage it. In terms of the future, I think that artificial intelligence is just incredible over the last couple of years, how things have been expanding and how everyone's got access to things like ChatGPT now. And we're starting to use those tools internally in health systems as well to make sure that we get to the bottom of things for patients to make sure we, for example, get the right diagnosis.
Yeah. Artificial intelligence it's a tricky one because there's so much of it is so beautiful that like they wouldn't be able to keep you here alive as a human if there wasn't for artificial intelligence. But then there's always that fear in the back of your mind. They're like, this is gonna get real bad real quick.
Yeah.
So artificial intelligence is definitely, but I'm sure with medicine, it's what it can do is just amazing.
Yeah, I mean, I think there's a lot of potential. We're still exploring how to best use it, and we certainly don't want to introduce technology that causes problems. We want to introduce it sensitively to make sure that we're doing things appropriately and also transparently for patients. Like, do you want to be treated by a doctor or do you want to be treated by an artificial intelligence bot? So I think there's a lot of humanity that the human doctors can bring, and we certainly wouldn't want to replace that with a machine that was, not human in its approach.
Exactly.
Yeah.
100%.
Yeah.
And I know you were just away for a conference. Did that conference have anything at all to do with artificial intelligence?
I would say yes.
Okay.
So it's called Diagnostic Excellence, or DEX for short. And it's an amazing conference where it brings together not just doctors, but also patients to talk about how do we come to the right diagnosis. And I've been going to these types of events for about 6 or 7 years now. 7.
Okay.
And over time, the use of artificial intelligence has skyrocketed in this field. And this conference was almost entirely about artificial intelligence.
Oh, wow. That's so exciting.
Yeah.
Okay. And I like the whole was doctors and patients working together because I think that's medicine can be intimidating. Like especially if you know nothing about it, like just all these and like finding out that you have these health problems and now there's all these doctors and then there's all these big people around you that know way more about the situation than you do. Like people may not I know no one is trying to make it intimidating, but it can just come across as intimidating.
For
So a
sure.
beautiful conference like this, that's just like bridging the gap. I feel like that does so much because a lot of times it's just taking that edge off so that the patient and doctor can communicate more cohesively.
Yeah, exactly. So, the types of patients or patient advocates that come to the conference are sometimes those who experienced a diagnostic error or whose family member experienced or perhaps even died due to a diagnostic error. So it's very emotional because, you meet people who are really battling the system, feeling unheard, and then, perhaps even experienced a bad outcome. So it's probably okay to share that you're familiar with Jake Tapper, who's an anchor for CNN?
Yes, yeah.
So his daughter, Alice Tapper, had a very high-profile diagnostic error case, and so she actually came and talked to the crowd about her experience going through a misdiagnosis where she had appendicitis, and as you know, the appendix, if it becomes a big problem, needs to be taken out.
Yeah.
But she and her family really felt that they weren't being listened to, and so she described that experience, what that's like to undergo this process of being essentially feeling like you're ignored and not heard and experiencing a bad outcome as a result of that. So it was very emotional.
Yeah. I mean, I know someone, I'm trying to not give specifics about who they are, but I know someone who had a similar experience with appendicitis where it was just appendicitis. They went to the hospital, like that should have been easy and done with, but they basically took too long. So then she had an infection and then she would have normally just been a hospital for overnight, 36 hours, she was in the hospital for a week because this infection came from the fact that not that there wasn't anything wrong with her body. I mean, she had appendicitis when she went in there, but had they, just acted promptly, it would have been an over and done with thing. But this left her with another infection, another health scare, another series of issues, and in the hospital, which is a huge cost for over a week.
Yeah, these are challenging cases, and as I was mentioning, they're emotional for patients who experience them, and they're also can be emotional for the providers behind the scenes because, at the end of the day, we're there trying to do the right thing.
Yes, of
course. And
then
sometimes things go wrong, and it's really can be honestly traumatizing for the providers as well as the patients.
Yeah, which I think that I'm sort of lucky that I have my dad and my brother where I get to hear the humanity behind the medicinal side of the industry and like really understand where healthcare professionals are coming from. Because when you are going through such a battle with your health and things are not going well, like I had one surgery that wound up lasting over a month because there were so many complications.
Wow.
It's easy to just get so mad and just be so frustrated with the doctor. But then luckily, like what my dad and my brother have always been able to offer me is that like, hey, these guys are people too. Like, they're just doing their best at the end of the day. They're not happy that it downplays their cred as well when your surgery doesn't go well.
Right. Yeah.
But I think what I would like to ask you then, spanning from that, is how would you recommend being the most effective way to communicate when you feel like you're not being heard?
Yeah, this is a challenging area.
Yeah.
So I'll start by saying that. I think if you're going to a healthcare appointment, a patient has the opportunity to prepare for that appointment.
Yes.
And sometimes it can be hard to know exactly as a patient what to say or how to say it. But I do think that, maybe even rehearsing how you're going to describe your symptoms or what's going on or what's most important in your life, if you can rehearse that a little bit beforehand so that when the doctor walks through the door, you're ready to go and, answer the questions that they have for you. But I think, beyond preparing, once you get into that encounter, it can be challenging if you feel like things are not going the right way. If you're a patient and you feel like things are not going the right way, to really get the provider's attention and get them to listen to you. It's a challenge.
Yeah, it's definitely. It's a challenge, and I think why it makes it especially hard as a challenge is that when it's your health, you're taking it so personally.
Yeah.
And as a doctor, you have to you have to not take patients personally in order to treat them the most effectively. You can't make them personally, but you're dealing with the patient who it's obviously so personal for. It's their health,
right?
And that causes. My New York accent was just so bad that obviously causes obstacles in communicating at times.
Yeah, it can. One thing that doctors are taught is that they should open the visit by letting the patient speak. Studies show that we're actually not good at doing this as doctors, that we interrupt patients very quickly. But the best practice really is to spend about 60 seconds at least listening to the patient tell their story. And so I think one thing that you can say to the doctor if you feel like you're not being listened to is, hey, just give me 60 seconds to explain to you, what's going on in my life, and please just let me speak for 60 seconds before you interrupt me. It can be challenging because of the power dynamics to, interrupt a doctor or tell them that you're not being listened to. But if that's really the way that you're feeling, I think you should feel empowered to demand the 60 seconds.
Yeah, and you should feel more empowered because another doctor just prescribed you that you're supposed to do that. So
you can tell them I told you.
So another doctor told you. No, but I've learned that people, when they're going through whatever battles, whether it's trauma just with dealing with stuff with friends or more serious trauma like your health, people just want to be heard. That's the main thing that people just want, is to be heard. And even if what they're saying makes no sense, they just want to know that someone is hearing it. So I think just saying like, hey, can you please give me 60 seconds that must alleviate so much where, Yeah,
I think so. I mean, it should be a dialogue, any visit between a patient and a healthcare provider. It should be a dialogue. But I think too often the doctors interrupt patients and don't listen enough. And that really contributes to downstream problems like diagnostic errors and like management errors, especially like just not recognizing where the patient is in their life, I think is also a common thing. Like, what is their home life situation? What is their work situation? Whatever problem that the patient is there trying to solve, like knowing the bigger picture is often helpful.
Yeah. So what drew you to emergency medicine where you don't usually get to know that part of the picture?
Yeah, great question. So I like adrenaline, so that's probably a big reason.
Definitely.
Yeah. And it's also, for me, it's about practicing medicine as a team sport, like I mentioned before. And the peers in the emergency department, everybody likes a little bit of excitement. And so, I remember the first time I shadowed in an emergency room, I was at Yale School of Medicine as a med student. And
humble brag.
Right. Well, the first question that the attending doctor who I was following around asked me was boards or skis. And I was like, this is a place where I can be. I'm a skier. So, I was like excited to just, talk about that for a minute, before we saw the action about what ambulance was coming through the door.
Okay. Yeah. So I love that. The boards or skis. That is such a wholesome path to emergency medicine.
Right, exactly. But I also would say that, in some medical specialties, you can't solve problems. So sometimes you're helping patients manage their end-of-life symptoms. I like solving problems. So things like fixing broken bones, sewing up people's lacerations. Those kind of have like an instant gratification vibe. So you'll also hear from emergency docs that that's another thing that we generally like is fixing things.
So many of the therapies that I've gotten and certain doctors that I've seen or that I knew I had to go and see, I only saw or I only started the therapy or I only made sure to make an appointment with this person because of my dad and because of my dad's area of expertise. And so often other brain injury survivors that I met when we're just, comparing the trajectories of our stories, our outpatient therapies, they're like, oh, how did you know that you needed that? And it's like, my dad, that's how I knew that I needed that. Not everyone has a medical professional in the family, but everyone has a right to their own health. So what would you recommend for people to look into to figure out what exactly do I need for what's going on with me?
Yeah, well, I think it can be a challenge if you don't have an expert in your family or your circle of friends. But certainly starting by looking online, I think is one way. I would have recommended last year to just Google things and to get some ideas. Maybe actually another place is to look on Reddit. If you find people with symptoms like yours or problems like yours, you may find a community there that you can kind of engage with if you're comfortable doing that online. Alternatively, these days, I do think that large language models like ChatGPT is another place to start, because while I would not take any of their advice, any of the advice from the bot, without a grain of salt, I certainly think it's a nice place to poke around, because it might get you 80% or 90% of the way there in terms of like figuring out what your next steps should be to manage whatever condition you've got.
Yeah. It can be a way to just like point you in the direction and to get you started.
Exactly. Yeah. I mean, the other reality is that some people have limitations based on their health insurance or lack thereof. So sometimes for patients, like if you have an HMO, you may need to basically go through your primary care doctor for everything.
Yeah.
So hopefully you find a primary care doctor that you really know and trust, because they're kind of the gatekeeper for you at that point, and you sort of need to take their advice. But again, in the spirit of preparing yourself as a patient for the appointment, I do think that, Googling or using ChatGPT or something similar to say, hey, what should I be asking my primary care doctor for? What kinds of referrals might be helpful for me, given that these are the conditions that I have?
Yeah, and definitely I cannot recommend that enough, because there are just so many things that like I wouldn't have known that I needed to ask for if it wasn't for my dad, and like so many therapies and everything that it's like, how did you get into this as early as you did? And it was because of my dad. So like it really made the difference having that piece of knowledge with me. So now that I know that, if I was to recommend that to anyone else who doesn't have a doctor in their family, I'd be like, you got to be digging deep in ChatGPT.
Yeah.
So this is a little tricky of a question.
I like tricky questions.
It's gonna be the trickiest question that I give you all day, probably. So when you're meeting with doctors, from personal experience, I've talked about this in other episodes, so it's not something I haven't said yet. I dealt with one surgeon who was the way he read was as narcissistic, callous. He was even rude to my dad, like as a medical, like from the perspective of like, that's a medical colleague, and he basically blamed me for all the complications that I was having. It was basically like, you're doing this you have to be doing this while you're sleeping. I was like, no, I'm not. And like was telling my dad, and my dad was like, she's not out. When you are in that kind of situation where it's the person's health and the surgeon, obviously it does, for the doctor, it does mean a lot to the doctor. Like he was probably just as upset. Like the truth is, like he was probably just as upset, because it's like, you want to do a good job just as much as you want your patient to feel like they're having a good job, but you're both angry and upset about different things. So I guess, not to be guidance counselor for third graders, but to be like, but how, when you do feel that there is tension rising when you're trying to communicate with the doctor, what is like the best path to just be like, I feel that we are both not liking each other at the current moment, but my health still doesn't work. So we still need to figure out what this is.
Yeah. These situations can be very challenging, I think. And dealing with any kind of person that you might describe as narcissistic can be challenging. Yes. And certainly a subset of doctors probably deserve that label. And so I think what I was saying earlier about asking for your 60 seconds is probably the first thing that I would try.
Okay.
Is like, hey, I feel like you're not listening to me, and please just give me 60 seconds to describe how I'm feeling and the challenges that are going on, because I want to work together to make sure that we come to the right conclusion on the next steps. So I think that's number one. Number two, sometimes getting a second opinion is really necessary, because sometimes there's just a personality that's not working out, or a personality combination that's not working out, and you just need to ask for a second opinion. But hopefully that's a limited number of cases.
Oh, yeah.
I think, also in general, surgeons and specialists really the person who did the procedure is the best person to be following up with you long term, because they know about your case, they know that what went well and what potentially didn't go well. So trying to maintain that relationship, I think, is good. But sometimes I think you can turn to your other communication skills you would use with anyone who's narcissistic. If you're starting a new visit, you might actually start the visit by complimenting them. You know, you might
Honestly,
say,
that's a great idea.
you might say, "Hey, Dr. So-and-so, I'm so glad to be here because you're the best at X, Y, and Z, and I know that you can help come to a workable solution for this
Yeah.
really challenging problem." There you go. That's a good way to start the visit.
That is a great idea. I wish I had gotten this idea when I was having complications for over a month.
Well, it's also hard if you're feeling emotional to take a step back and try to figure out how to, I don't want to say manipulate, but to use a strategy to have more effective communication by trying to manage your own emotions by doing something like complimenting them when you're actually mad.
No, but that is definitely, it's hard when it's your own emotions. And then it's so hard because health is so personal that like it's only you there, or maybe an immediate family member if it's something really serious. And then your immediate family member might be more emotional than you are. So it's like this whole, and it truly is like we need a guidance counselor. It's really like a guidance counselor should go in with the patients to their appointments.
Well, the other option you can actually do, which is to go with a patient advocate, to literally hire someone to go with you and help advocate for you.
Oh, wait, that's a thing?
Yeah. So there are, actually, this is probably a good option for people who don't have a medical person in their family.
Yeah.
Is to reach out to a professional patient advocate.
There's my God, there's a patient advocates. That is so cool.
Yeah.
I'm assuming you know about those from your work with the future of diagnosis.
Yeah, that's the main way that they've come across my doorstep, so to speak, is through that conference. But certainly, I do think that patients, when they're having communication issues, also often if there's a language barrier, for example, they might have not just an interpreter, but also someone helping them out from the advocacy standpoint.
Okay. Are patient advocates have they been patients? Do they have a degree in a specific area? Like, how do you become a patient advocate?
I think it varies. Many of them have experience being a patient or managing a challenging health condition. Others have, gotten a degree related to health or health advocacy or communication. I think there's a wide variety of sort of training backgrounds, but many of them have like a master's degree, for example, in health.
Okay. No, because the reason why I ask is because I'm like, oh, maybe I could do that.
Well, you certainly could. Yeah, you certainly could. I think, there probably are some doctors who might be put off or feel like, they need to be on their best behavior, or maybe even feel a little bit annoyed that you're bringing an advocate in. But if you really need to advocate for yourself, it's an option.
Okay. Yeah. No, I'm like, I'm like, maybe I could be a patient advocate. I'm like, maybe I could do that.
That's a great idea.
I was like, like that could be a future down the road thing. I don't know where my life's going to go, but who knows?
No, I mean, that's a great idea.
Yeah. But just because, it's not very common that people that are younger, in their 20s or whatever, have a brain injury. And that was one of the hardest parts I found, like, after I left your hands. That was one of the hardest parts I found going through it, is I was like, I am not an elderly person. Stop. I'm dealing with a different series of circumstances. So, I was like, that would be a cool thing to, like, be able to help other people that have a brain injury when they're younger, can like be like, listen, I get it.
Yeah.
But I wanted to ask you, what do you think was the best advice you got from med school? The best advice you got from, or the best advice or best thing you learned in med school? The best advice or best thing you learned in residency?
Okay. Yeah, I guess the best thing that I learned in medical school was that you're going to meet a lot of patients from diverse backgrounds. And so really trying to understand where the person is coming from is a huge part of the evaluation. I met patients who spoke a wide variety of languages. And so just trying to figure out how to communicate with people from different backgrounds, where the language, the education, everything, their social situation is completely different than my own. So, you really have to kind of meet people where they are. I think that's the most important thing I learned from there. From residency, I think it's that life is beautiful and that you need to appreciate every day that you have because tragedies happen.
Yeah.
But also like really amazing things happen. And I'll give an example. On one shift, I delivered a baby in one room and then pronounced someone dead in the next room. And it was like a mystical feeling where it felt like the soul of one person actually went into the body of another. And it was like, I'm not a spiritual or religious person, but it was very moving to just feel like, we're bringing life into the world and we're also helping people exit the world at the same time.
Well, I mean, I am very spiritual. That's what this whole thing's about. Yeah. But no, but that must have been the most beautiful moment. Like in a weird, like, yes, you're pronouncing death and that's terrible. But like, there is an exquisite beauty to that like, as someone's born, someone is dying. Like as I'm dying, someone is born. That must be so cool.
It is special. Yeah. It's a privilege, really.
Yeah. Wow, that's beautiful. I do think it's very interesting how you said the most important thing is to learn where everyone's coming from. So I chose the medical field where I don't get to know where anyone's coming from.
Well, I think some advice I got from people that are more senior to me is at least one time during the shift, every time during the shift if possible, spend a little bit extra time at the patient's bedside to really understand their circumstances and relate to them. So for me, just to give a concrete example, if I happen to be sewing up someone's cut, their laceration, that's often a time where I have a little bit more time at the bedside to actually chat with them while I'm doing my work, right? But
we didn't get to chat much.
Right, not too much. Well, I'm so glad we get the opportunity now.
We do. But I was a little quiet.
You were.
I was a little quiet. But before we say goodbye to you, this was absolutely amazing. But before we say goodbye, I was wondering if two things, and you can answer both, neither, or just one. So my first one was if there's anything I've already recommended The Pit to the audience.
Great.
But if there is another, like so emphatically, but if there's another, and now it's won all the awards.
Yeah.
So you heard it here first. But if there's another like piece of content, a book, a TV show, a movie, anything, a radio show, anything at all, a podcast that you think people should listen to, about health, about whatever you think is important. And then also just the last question that we'll end on is with your day-to-day of seeing the absolute worst cases for people, like what has that taught you about life that you think we should all try to remember?
All right, so I'll answer question number one first.
Okay.
So in terms of content that I would recommend, lately I've really been loving public radio. And it's a great time to love public radio and actually donate to public radio because there's less support on the federal level for public radio. Locally here in LA, it's called LAist, the radio station, where they cover local news content and, of course, health-related content. But it's one of the only sources for local news, and they do provide a lot of content related to health. And it's a time when I think that we really need to support them because they're hurting financially compared to the prior situation for them.
All right, we got one supporter.
In terms of your other question was, I would say that watching The Worst of the Worst for me inspires me to live every day, to make sure that I find time for fun. Because it's easy to get kind of absorbed in our lives and get stressed about, little things that are happening. But in terms of the big picture, like it's really a blessing to be on this planet and to be, enjoying a beautiful day like it is today and to be having fun. So I think it's really like, people who are at the end of life sometimes wish they had lived more. And then people who've got this amazing opportunity to enjoy every day should just be out there enjoying it.
Yeah. No, yes. Yes. No. And I always say now, and I definitely didn't have this mindset before I got hurt, but I always say now, like, if your health's all right, if your loved one's health is all right, if you've got a roof over your head, if you know where your next meal is coming from, everything else will figure itself out.
Yeah.
Like everything else will figure itself out. Like it's all good.
Yeah.
It's all good.
Exactly.
Well, thank you so much.
Thanks so much for having me.
I feel like thank you so much for coming here, but just like thank you for like talking about living every day. Like you're the reason I get to continue to live days. And like
Well, thank you for the thank you. And I mean, for the listeners out there, if you have the opportunity to thank your emergency doctor, we really appreciate it. This has been such a unique experience for me. It's really special.
Yes, that's the other thing I definitely want to drive home is that you said to me it was such a rarity that I met you and that and I only did that because of my dad. If any of you have been, any listeners, in a crazy medical situation, get your emergency doctor's information and thank them. They don't get it a lot and they should, like, clearly, like, do that.
Yeah.
Do that.
Love it.
Nick, if you're ever in an emergency medical situation, get your emergency doctor information and send them a thank you. But thank you so much, Dr. Berdahl.
You're
this
welcome.
was
Thank
incredible.
You.
I hope that we are able to do a lot and spread. If there's anything else you would like to say, just to about the future of diagnosis, just to get any more information out there. But I think I'm happy that you're so hopeful about the future of medicine because I don't think a lot of people are. And I don't think people are hopeful about the world in general, not as medicine specifically. And it is so refreshing and a reminder that hey, we all need hope. That's what keeps us going. There is hope to be had. So
totally
thank you so much.
Thank you.
So thank you so much. This has been Gabriella Rebranded. You guys know where to find me. I'm going to finish telling you all that after Dr. Berdahl leaves. I don't want to bore him.
Oh, great.
Yes.
Thanks so much.
Thank you so much. Yeah. Okay. That was amazing. That was seriously a little bit of a fever dream that he is Dr. Berdahl, he's such an incredible person and just, again, really did save truly every time I've seen him, which has now been a grand total of 2 times. But every time I've spoken with him, it is just you are the reason that I'm here. And a lot of people are the reason that I am here. But he was, as I said in my terrible metaphor, he was the first step in a lot of steps, but a lot of steps that I would have never gotten to climb if it wasn't for climbing that first step. And it was Dr. Berdahl who allowed me to climb that first step. So thank you guys so much for listening to that episode. And I'll be pasting a link in the show notes to this sheet that he was talking about. It's called a Smart Note sheet by the patient. The name of the conference that he was at was the Patient Partnered Diagnostic Center of Excellence. The Patient Partnered Diagnostic Center of Excellence. And they have this thing called a Smart Note sheet that he was talking about. And I'll be pasting a link to it in the show notes. And it's basically how you can eloquently and easily write down everything that's been going on, all the ways you've been trying to treat it, what has worked, what hasn't worked, any updates, new information, any other related visits or referrals you've had or hospitalizations, and what may be on your mind, what you're thinking about trying. What did ChatGPT tell you to do? You can write that on the sheet. And this way I would know personally that you may think you know what you want to talk to when you're going into a doctor's appointment. And then when you get into there, it's just an intimidating atmosphere and you forget the questions that you wanted to ask. And I so often after appointments would say to my mom, oh, I should have asked about that. Oh, I forgot to ask about that. Oh, I forgot to ask about that. And then after the fact, we're making calls, we're sending emails saying, I forgot to mention this thing. So this is really helpful. And I cannot encourage you guys enough to have this and to take notes when you head into your appointments. But other than that advice that we've shared, that Dr. Berdahl has shared, thank you guys so much for listening. Again, please, review, subscribe to my newsletter, GabriellaRebranded.com. Follow, review, subscribe at Gabriella Rebranded on TikTok, at Gabriella Rebranded on Instagram, all the streaming platforms. It's available to you all. I'm sorry, I'm delirious a little bit because this episode was a fever dream meeting every time I speak to Dr. Berdahl. Thank you guys so much. This has been Gabriella Rebranded, when most lose some.